Hi everyone, my name's Heather and I thought I would do a video on heterotopic pregnancy. I had my tubes reversed in December of 2016. With that comes a risk of ectopic pregnancy. So I knew my chances were high. The closer you get pregnant to having that procedure done, the higher your chances are. I was able to get pregnant 3 months after my procedure. And when you have your tubes reversed, they recommend you get your levels tested every 2 days, immediately when you find out that you're pregnant. This is because of that high chance of ectopic pregnancy, and they can tell by your levels if there's any issues or there's a higher chance of being able to catch it sooner. They also recommend doing an ultrasound when it reaches, I believe it was 3,500. That's when they can typically see a heartbeat too. It's around 5 to 6 weeks. So everything seemed to be going good. My levels were not doubling as they should every 48 to 72 hours. They were tripling and quadrupling. That was a great sign. And I also started getting worried that it was twins. And my doctor didn't indicate anything, but I could tell by the nurse when she would call me with my results that they were pretty high and strong. So even though I reached that 3,500 mark pretty quickly, I think it was about 3 weeks along when I first got my positive test. And they scheduled my ultrasound at 5 weeks. And my levels just kept going up and up and up. So I was doing some stuff in town. I noticed I had no signs whatsoever there was any issues. Like I said, my levels were going up. I was standing in line at the doctor's office. I was getting some medical records for my son. And earlier that morning, I had felt like bladder infection type pain. And I called my doctor to see if I could do a UA. So I was waiting for their phone call back. I was standing in line at the doctor's office for my son, and I just felt sick. Pain, sick. I can't even begin to explain. The longer I stood there in that line and it was taking forever, I felt faint. I felt just not good. So I left the line. I got back to my car just in time. That pain, it was so bad that I fainted in my car. I woke up, opened the door, threw up, and magically the doctor called. And I told her what was going on, and she said, "You need to get to the emergency room now." Now, I should have called an ambulance. I should not have drove, but I drove across town to that doctor's office feeling like I was going to pass out again. The pain was horrific. I've had 4 kids, had a major abdominal surgery. This pain was worse than all of that. It was so bad. So I get to the emergency room. They get me back right away. This is about 10 o'clock in the morning at this point. And they get an ultrasound done. That was so bad. Just the wand on my stomach hurt so bad. What they discovered was a sac in my uterus and what they initially called a cyst in my tube. And they weren't 100% sure if it was a ovarian cyst that had ruptured. They noticed a lot of fluid in my abdomen. So my doctor came down to the emergency room and saw me. About an hour or two after I arrived, I can't remember it all. And he said my HCG levels were 6 times what they should be. And there is most definitely multiples. He wasn't sure if the baby in my uterus was an actual baby or a pseudosac, which is apparently common with ectopic pregnancies. He was pretty sure that I had an ectopic pregnancy in my right tube, and we needed to go in right away and take care of it. He indicated that I was miscarrying out of the top of the right tube, which is why they didn't see any fetal components in the tube anymore and just mainly like all this fluid, because it had already been ejected basically from my tube. Once he was down and saw me, I was in surgery within, 20 minutes. I was back there. He was not messing around, and this became an emergency situation. So we're back there. I wake up and I find out that he needed to completely remove the right tube. He said that the pregnancy was no longer there, but he could not stop the bleeding in the tube. Therefore, he had to remove it completely. Cleaned out all the fluid he could in my abdomen. I had minimal actual blood loss, so I didn't have to stay the night. I was able to be discharged that evening to home. And he did not do a D&C in my uterus as they typically would with an ectopic, because there was the chance of a viable pregnancy still there. At this point, I was only 5 weeks along, and my HCG was over 200,000. And he was really concerned. So a week later, I get a call from my doctor, saying I need to come in right away. I need to have my husband with me to share the pathology results from my tube. This got me scared. So I come into the appointment and I find out not only did I have an ectopic pregnancy, it was a molar ectopic pregnancy, and I was still pregnant. At this point, my pathology results or contents have been sent on slides over to Johns Hopkins on the East Coast for specialized review, and they have come back with a diagnosis of cariocarcinoma. So I now have a pregnancy, a ectopic pregnancy, which makes it heterotopic, one in the uterus, one outside of the uterus. It's typically in the tube, but it could be even outside in the abdomen. And I have cancer. Cariocarcinoma is a type of cancer that you can only get from being pregnant. It is a curable type of cancer. So at this point, I have appointments for University of Washington, and I spend my birthday, April 5th, having appointments with the oncology gynecology department. They order an MRI, chest x-ray, and ultrasound. I go in to have the MRI done on April 9th, and the radiologist has the nerve to cancel my MRI and tell me that I need to wait until I'm further along due to the risk to the unborn baby. I proceed to tell him that the risks are far less me having this MRI than me keeping the baby, as I might be going in for a termination and immediate chemotherapy and radiation inpatient for 2 weeks if this MRI comes back that the cancer has spread. The fact that the molar pregnancy has miscarried into my abdomen and I was bleeding had me a high chance of having cariocarcinoma spread throughout my abdomen and up to my lungs. It goes from your abdomen, your lungs, and then to your brain. And it can spread very fast. I was so mad. My doctor was so mad. He didn't even consult with my doctor. He just canceled. He actually canceled it twice. And and MRIs they have no radiation. It's high magnet. And there's actually no proof that it can cause harm to an unborn baby. So I have this MRI done. And for whatever reason, nothing spread. There is no signs of anything anywhere. There is no explanation for why it didn't spread, but I'm still on high watch at this point. I go in for ultrasound. Baby appears to be doing well in my abdomen or my uterus. And I continue to have blood drawn every 3 days to make sure my HCG levels actually go back down to a normal singleton pregnancy. The doctor later told me that the level that my HCG was at 5 weeks along was enough to carry 6 babies. But I only had 2. The reason why it was so high is because it was a twin pregnancy, and molar pregnancies tend to put off a extremely high level of HCG. Had this baby, this twin, actually go into my uterus with the other baby, it would not have been caught for a few more weeks when I had my ultrasound, and I would have had to terminate the entire pregnancy and had a high risk of high chance of needing a hysterectomy. A lot of times in pregnancy, they don't do ultrasounds until 19 to 21 weeks. And at that point, they find this molar pregnancy that has grown huge. And that's what happens. You have to have an emergency hysterectomy. And that baby you thought you're carrying, it's not viable. If you're not sure what a molar pregnancy is, that's when the chromosomes are off. Typically, like 2 sperms enter 1 egg, or I should have looked at the definition. Typically, it's like 2 sperms enter 1 egg, and it's just not a viable baby, and it doesn't grow right. And so from what I understand, I am the only documented case in the United States, possibly the world, of having a living baby with these circumstances. And William Patrick was born November 3rd, and he was close to 8 pounds, healthy baby. I did end up having hydronephrosis and needing another urgent surgery within the pregnancy at 28 weeks, and later went on to having a major kidney surgery after when he was, I think, 7 months old, and that's all fixed. And Mr. William is William, you say hi? Say hi. There's William. He is now 2.5 years old and so healthy. We are so in love with him. I often wonder what it would be like to have twins.
Hi.
And I had the worst anxiety after he was born. I felt like I almost lost him so many times. And he's here, and I can't imagine my life without him. If you have any questions about heterotopic pregnancy, ectopic pregnancy, or even tubal reversal, feel free to comment or send me a personal message. I'd love to share why I had the tubal reversal, and I'll actually do another video. It wasn't actually to have another baby. I had what's called post-tubal ligation syndrome and had severe side effects as a result. Once my hormones were basically restored from having my tubal reversal, I went ahead, I started desiring another baby. The plumbing was working. And we went on to have William. And then I actually got pregnant when William was just over a year old. And we now have Skylar, who is 7 months old. And went on to get my husband fixed. I'm not doing a tubal again, and I'm not, we have 6 kids, and we're done. I am exhausted. It does not get easier as you get older, and I need sleep. Anyways, so, like I said, feel free to comment, ask some questions, message me if you have any questions. You are going through the same things. I'm going to cut this off. All right, have a nice day.